let's go right into the roots of traditional Chinese medicine in terms of making an assessment. You'll learn the principles and the importance of making an assessment based on traditional Chinese medicine. Now here's Dr. Malik Cotter.
In this video, we're going to cover some insights and some techniques, protocols to use to make a proper evaluation assessment. This is absolutely key to make the evaluation, because without the evaluation, you don't really know where you're going. You don't have a principle. You're just kind of like shooting in the dark. But when you have your evaluation, your assessment, then you know which way you're going and how to go about it. The hardest part of working in energy work or physical health and as a practitioner is the evaluation, the assessment of the patient, the client. So what we want to do is we want to get some understanding on how this all comes about. Now, the condition of the interior part of the body, the organs, the visceral organs, are always going to be reflected in the exterior. It's the, to use a natural kind of a metaphor, the condition of the tree roots is seen in the leaves of the tree. You can look at your plant and you can see whether the leaves are withering or brown or they're yellow or they're bearing fruit. This all gives you an idea of the root system. In the human body, the root system is going to be our energy, but that energy comes down into our internal organs. And these internal organs that we have actually control or give life force to the extremities, the muscles, tendons, etc., etc. When we have a discomfort, we have an illness, an imbalance going on, we need to find out what the root is. If we're just going to treat the symptoms and the signs, then it's just going to come back. It's never really going to get healed. It may transfer somewhere else or it may go deeper into the body. It's more important to know what sort of person has the imbalance than the imbalance that the person has. Because if you know the person, then a lot of it has to do with the way our global view of how our meta-programming is, how we're looking at things. Are we looking at it with negative, reoccurring, repetitive patterns? Are we looking at it with optimism? Are we looking at it as just being what is in the moment and accepting as we go and always working towards an optimal health condition? The assessment is key. The evaluation assessment is so important. Now, what we're looking at here in traditional Chinese medicine, we're working with a natural science, not so much a physical science. A natural science takes into consideration the energy that's coming and how it's moving, where it began. Is it blocked in different aspects? Is it deficient? Is it too much? How are things manifesting in the body? Now, assessment is based on the patient's history. We take the history of the patient so we get an idea of where they're coming from and what they've been doing. We also are looking at the direct observation. Very important point in evaluation, to directly observe the person, the client you have in front of you. That is where you're going to put your focus. This is where your concentration is. Now, it's really important that when we do this energy work, that we have confidence in our technique, we have confidence in our assessment, we totally understand what it is we're doing and what it is we want for our outcome. We hold that picture as our outcome. Our evaluation allows us to see this. Now, direct observation will tell us so much because the body is going to be wearing the energy of the internal organs. So we can just look at the skin, the face, the complexion, the pulse, the tongue, and we can draw a real good picture of how things are and where we want them to go. Now, what we want to do is we want to take a real clear picture. We want to get this picture of what's going on inside the person so we can be there. So the client can receive this balancing back to bring them back into health and bring them back into a state of joyful acceptance of what is. Now, the physical examination in Western medicine is different than in energetic in the traditional Chinese medicine. In the energetics, we understand something, that the human body is just more than just matter. There is a life force that comes to us. And Western medicine, I'm not sure if they really pay a lot of attention to that. We do. Energy workers, what we want to do, traditional Chinese medicine gives us a whole set of evaluation and assessment techniques we can use to draw this picture that we want to see. In Western medicine, they're going to use lab tests, they're going to use CAT scans, they're going to use a whole lot of scientific data, which is basically looking at the matter of the body and how it's working. But we're interested in where's the block in the energy field, not so much the block in the physical body. Because if we take care of the energy field imbalance, the physical body will respond. And that's what we're looking to do. We're looking to go deeper and more subtle than just taking some blood or putting someone under an X-ray machine. When we look at assessment evaluation, we have first our examination. Now, the examination, which I will cover a little bit later in how to do these different methods of examination, we gather data. What we're doing is we're gathering information, and then the most important part is to interpret it. Now, when we interpret it, can be a little tricky because now we're being subjective, and that's a trick because the person interpreting needs to be absolutely personality-wise out of the way. You just need to allow your intuition to come forth, and then you will get your interpretation of what it is you're collecting in your data of assessment evaluation. The hardest part of traditional Chinese medicine is probably assessment of the client. This is probably the more challenging because you have so many different variables, and then they all come together in a composite. And the idea is to take all these pieces, like a jigsaw puzzle, and put all these pieces together so you get a real clear picture of what's going on with this. Now, the zangfu, or the internal organs, in Chinese medicine we call it the zangfu, the internal visceral organs, they're all connected with one another. The kidney and the heart, the liver, the pancreas, they all are communicating with each other. Every cell in our body is communicating with one another. We should understand that at the base of all of this energy that this body is we are electromagnetic. We are receiving electrical impulses which allow all of the organs to work, which allows us to have animation, to think, to comprehend, to assess, to judge. These are all part of how we work. So the internal organs, the visceral organs, have correspondences, and I'm going to talk about those a little later also. What we want to do is we want to get the person back into balance. Now, the methods that we use in traditional Chinese medicine, the first one is looking. We observe. We take a look at it, and I'm going to cover this more in depth in a little bit. The observation is extremely important. We look at what's going on, we evaluate, we make notes, we start drawing our picture. The second one is to listen and to smell. Now, you may not understand smelling as an evaluation assessment procedure, but it's very important, and I'll explain that also in a little bit. Inquiry is where we start asking questions. We would like to find things out, but we don't necessarily want yes and no questions. We want more open-ended questions so the client can express themselves in their terminology, in their wordage, which is all very important. A real key for as a practitioner who is doing energy work on a client is to listen. Most of the time, the client just needs someone to talk. They need someone to talk to. They need to have someone listen to them. And as they are telling you something, you will get so much insight into that person. So inquiry is our third method, extremely valuable, extremely important. The last method is palpation. What we're going to be doing, this is touch. This is where we're going to take an examination of the pulse. We're going to look at the abdomen. We're going to touch the body. We're going to feel different points on the body to feel whether or not what the thermal condition is of those points. So palpation is a very important part also.